In this presentation, I will describe my personal nursing philosophy and relate it to a personal experience I had with a patient. If we compare a home to the nursing meta paradigm, they each would have a place within it. The foundation of the home represents health. All people have some level of health, just as all homes have a foundation. The door represents people. Those who require nursing care and their family members will enter through this door. The inside of the home represents environment. This is the space where we provide nursing care. And the heart of the home represents nursing. It is providing compassionate and holistic care. My personal story begins with a 3-year-old boy. His diagnoses included GERD, which required a daily medication. He was developmentally delayed, and he was deaf. We are all created by God. People require trusting and caring relationships from the moment they are born. I connected with Hildegard Peplau's interpersonal relations model and her definition of person. In Hood, Peplau's model states that growth and development is cultivated through having relationships with others. Person is not only the individual, it also includes their family. The patient is someone who requires nursing support and interventions. It is imperative that nurses develop a good working relationship with the patient in order for them to trust and work collaboratively with us. The parents began to notice signs and symptoms of reflux, which included vomiting, coughing, and increased agitation in the patient after meals. So his physician ordered patient to be admitted for a 24-hour pH study to assess his reflux medications. A pH study requires the nurse to place a small flexible tube down the patient's nose so that it sits right above the stomach. I view health as a state of being which is similar to a swinging pendulum. Throughout our lifetime, we will consistently go back and forth between being healthy and ill. When a patient is physically and mentally healthy, they do not require nursing care. So does health mean that someone is free from disease? I don't necessarily believe that is true. Working with pediatrics, I have seen patients with diseases be healthy and stable enough that nursing care and interventions aren't required for a time. My definition of health correlates with Imogen King's. Hood states King's definition of health as health assumes achievement of maximum potential for daily living and an ability to function in social roles. The patient was admitted to the pediatric floor at the University of Minnesota Hospital and was assigned a single-bed patient room. Because the procedure is uncomfortable, we wanted to make the environment calm and relaxing. We closed the curtains and darkened the room as much as possible for my coworker and I to complete the study, and someone from Child Life Services came in and blew bubbles to distract the patient. The environment is any place where nursing care can be practiced. It is important that we keep the patient's environment as calming and therapeutic as possible. If the environment is in chaos or stress, the patient's recovery will likely take longer as they cannot focus solely on healing. Again, my nursing philosophy aligns well with King's model. King states environment is a context within which human beings grow, develop, and perform daily activities. My coworker and I provided nursing care to the patient before, during, and after the procedure. Prior to placing the pH probe, we answered parents' questions about the procedure. We gave the patient Versed and also put numbing gel on the probe to make it a little bit more comfortable. During the procedure, we asked Mom to lay by the patient and hum softly so he could feel the vibrations from her humming, which was calming to him. While placing the probe, we had to watch the readings on the equipment to know when the probe was in the stomach. We then pulled the probe back so it would lie above the stomach. And after the procedure, an x-ray of the patient's chest was taken, and I went with the x-ray tech to read the x-ray and verify proper placement with the radiologist. Once this was verified, I taped the probe to the side of the patient's cheek. As shown in my personal experience story, nursing is both a science and an art. The science part of nursing consists of clinical skills we learn while in school and on the job, such as disease pathophysiology and taking vital signs. The art piece of nursing is how we care for the patient. It is knowing how to create a peaceful environment for the patient when certain tests or procedures are going to be performed. It is holding the hand of a dying patient and listening to the grief and loss of the family members. Nursing truly is all about caring. My views of nursing align with Jean Watson, a developmental theorist. She states, caring is the most important aspect of nursing, and the nurse enters into the experience of another person, and another person can enter into the nurse's experience. Here are a list of references I used for this presentation.